Learning you are a diabetic can be scary, but it is highly treatable. Those with type 1 diabetes have a pancreas that does not produce insulin. Those with type 2 diabetes, well, they produce insulin, but their bodies just can't effectively use it. November is Diabetes Awareness Month, and you may know someone who has diabetes and not even realize it.
Hi, I'm Tom McClanahan. Thanks for joining us on Live at 5.
They come into your home on a regular basis.
Good evening. Thank you for joining us. I'm Sadie All.
They share stories about other people. But today the story is about them. They have different forms of a chronic illness.
I have type 2 diabetes.
I have type 1.
Tom was diagnosed with diabetes 4 years ago.
I wasn't really surprised because I've had so many relatives that are diabetic, but still in all, it was, kind of a shock, a small shock.
Sadie was diagnosed just recently.
So they told me you have diabetes, and I started crying, and it was just really shocking news because I had no idea.
According to endocrinologist Dr. Rico, diabetes is not something to be feared as it was years ago.
It was once widely believed that if a patient with diabetes lived long enough, they could expect to go blind or end up on dialysis or suffer amputations. And now we know that that's not true at all, thankfully.
But the key to preventing these problems is controlling blood sugar. While Tom and Sadie have different types of diabetes, they're treated in similar ways. Tom and Sadie both adjusted their diets and are working on getting more exercise. Both lost weight. Each checked their blood sugar levels. Tom takes a pill daily and a once-weekly shot. Sadie takes insulin every day.
A person newly diagnosed with diabetes today can expect to live a normal lifespan.
Neither Sadie nor Tom wished for diabetes.
It does impact you. You're constantly conscious of what is going on and what your body's trying to tell you.
Both made changes.
In the past, I'd buy a bag of Oreos and eat half of them with 2 or 3 glasses of milk. Now you just need to eat one.
And now they're learning how to live with it. And it is recommended that you get your blood sugar checked yearly. Those with a family history of diabetes and people with high blood pressure or high cholesterol also want to keep an eye on their blood sugar levels.